Todd Tarrant. I'm an optometrist with Essilor of America. Today I'm at the Vision Performance Institute on the campus of Pacific University College of Optometry. I'm here with vision expert Dr. James Sheedy. So Dr. Sheedy, we're here to talk about visual fatigue. Could you please introduce yourself to the audience?
Dr. Tarrant, it's a pleasure to be here today. My name is Jim Sheedy. I am a vision expert. I'm a professor here at Pacific University College of Optometry. The Vision Performance Institute is where we do our research, and I largely direct that institute. And I've spent a career in the corporate world and in the academic setting, and I've also been in private practice. And I think it's fair to say that I've earned a reputation as an expert in vision ergonomics and some of the eye strain issues associated with doing a lot of work at computers, for example.
Well, great. Well, we appreciate you being here and talking to us about the topic of visual fatigue. So, what is visual fatigue?
Visual fatigue actually I see as just one symptom in a category of symptoms. And this started with, when people started doing a lot of reading, and it's gotten worse when people are doing a lot of work at computers and other digital displays. People get symptoms, and these are symptoms of eye strain, symptoms of neck aches and back aches, symptoms of vision disorders like blurry vision, double vision. And so I would say that visual fatigue is sort of like a catch-all category for all of these symptoms.
Right. I know many people who complain about this and ask me about it routinely. What do you feel causes visual fatigue?
Well, these symptoms can be caused, I put it into two categories. The symptoms can be caused by a vision disorder that the person has, or it can be caused by something in the environment that makes the job more taxing than usual. In my opinion, everyone has a threshold beyond which they will get symptoms. And if they have got a compromised visual system, they will get those symptoms more quickly. Likewise, if they have a very harsh work environment, they will get those symptoms more quickly.
Mm-hmm. And Dr. Sheedy, how do you diagnose the underlying causes?
Well, just as with any clinical entity, I think the case history is of paramount importance. So I urge all eye care practitioners to pay attention to what the symptoms are of their patient. And I tend to put the symptoms into three categories. The first category are vision disorders. Are they having any blurred vision, double vision? Those types of things indicate to me a vision disorder, and it will help to guide my testing and my diagnosis. Another problem is the musculoskeletal problems. Back aches, neck aches, shoulder aches, even wrist problems. Now at some level, those are not the domain of an eye care provider. But as eye care providers, we need to pay attention to those because sometimes it is an eye problem causing those issues, especially since we have the saying, which is quite true, that the eyes lead the body. The third category that I believe a clinician should look at is a general category called asthenopia. Does the patient have some symptoms, eye strain symptoms, visual fatigue, more of these ethereal type symptoms that aren't as well defined.
Sure. And now, what do we do about it? How do you go about treating visual fatigue?
Well, of course it depends upon what the history is and then what the test findings are. But I will still divide it into those three categories. If it's a vision disorder, and if it's caused by an accommodative problem or a binocular vision problem or a refractive error problem, then we will fix that vision problem. I mean, as eye care providers, we're very talented at doing that. Next is the musculoskeletal issue. And with that, we like to look at the workplace setup, but also what's really important there is the correction of presbyopia. Mm-hmm. Presbyopia, as we know, is the age-related loss of accommodation, and you now need to use spectacles in order to provide the power, the refractive power, to see something up close. Well, general issue bifocals or progressive addition lenses, the add is way low in the lens, and if the person is going to use it, they need to assume an awkward posture, very often tilting their head back and maybe even leaning forward, and now you create a neck ache and a backache. So proper design of the spectacles becomes a very important issue when treating musculoskeletal issues. And then when it comes to the more esoteric symptoms, the asthenopia type symptoms, in our studies we have clearly defined two types, two constellations of symptoms, if you will, and their causative factors. One set of symptoms is related to dry eyes. Okay? It's a dryness or an irritation felt on the front surface of the eye, in which case I urge the clinician to start looking at the dry eye treatment. Does the patient have a fundamental dry eye? Also, are there some things in the work environment that cause it? Because dry eye conditions seem to be associated with lighting problems, glare problems, poor quality of a computer display, etc. The other type of asthenopia we call internal symptoms. It's an ache or a pain that is felt inside of the eye. And that tends to be caused by accommodative problems, binocular vision problems, and refractive error problems. So we will then solve those problems with whatever our clinical findings are.
Great. We're here at the Vision Performance Institute with Dr. James Sheedy, speaking on the topic of visual fatigue. And Dr. Sheedy, do you feel visual fatigue is more prevalent in different areas of the world? Is there an area of the world where you might find it more frequently?
You know, there have not been good controlled studies to test whether certain ethnic groups are more prone to experiencing eye strain. But in my experience and treating a lot of people from different backgrounds, I find that anyone can be prone to getting this type of eye strain. The visual systems are not fundamentally different, and if you take people and put them into an environment that is very visually demanding, anyone can get symptoms. Now, having said that, I do also believe that as we see countries becoming more developed, the developing world has people sitting at computers. And you know, when people were tilling the soil, they don't get eye strain, but when they're sitting in front of a computer all day, they do.
They certainly do. Great. Recently, there's been a great deal of attention given to the issue of the blue light hazard, or a potential blue light hazard. What would be your thoughts on this?
You know, the blue light hazard issue is a real interesting one. Yes, blue light can cause more retinal disorders. The retina seems to be particularly sensitive to blue light. But to be fair, you must have high blue light levels in order to accomplish that. You have got much more blue light outdoors than you do indoors. And you can spend all day in front of a computer and not get the same level of exposure to blue light as you will outdoors. So as far as protecting the eyes from damage, the greatest protection is needed outdoors. Wear good sunglasses that protect from blue light. Now there are other issues about blue light. It's been suggested that blue light is related to eye fatigue, and it might be. Blue light also seems to play a role in the circadian rhythm and the sleep-wake cycle. So you don't want to disrupt that cycle, but yet you still want enough blue light that you want to engage that cycle and kind of keep it going. So all in all, I would say that most of the research indicates the possibility that blue light, especially high energy blue light, is causing damage and is bad for the eyes. So it seems to me prudent to eliminate a lot of the blue light, but you don't want to completely eliminate it. I would probably suggest that we still have some of the longer blue light wavelengths so that we can still engage the circadian rhythm and also have the minimal impact on the person's color vision.
So selective filtering.
Yes, selective filtering is a great strategy, I think, for protecting from blue light.
Great, well thank you. That's been very interesting to hear. This has been a very illuminating discussion about visual fatigue. Thank you very much. It's an important issue for good vision and for great quality of life. Thank you.